Good evening, everyone, or good afternoon, depending on where you're joining us from. On behalf of Nigeria Mental Health, a truly warm welcome to the launch of what promises to be a groundbreaking resource, Nigeria's first national in-person mental health and rehabilitation centers directory. I am Deborah Omage, Programs Associate, Nigeria Mental Health. Nigeria Mental Health is the country's largest multifaceted network, leading over 50 organizations, bringing about change in the mental health space. Our work is focused on policy reform, data and information, wellness, and basically peer education. We are happy you can join us for this event as we work towards increasing access, visibility, and collaboration across the mental health space. Your presence here signifies a shared commitment to mental well-being in our communities. The objectives of this launch include, first of all, the most important reason why we're here, that is launching the first verified National Mental Health Directory, increasing access to mental health service, basically bridging the gap between need and available support, enhancing the visibility of mental health providers, and promoting collaboration, ensuring that we have a stronger mental health ecosystem in Nigeria that serves the population. Our session will include the opening remarks from Mr. Chime Asoye, would have a keynote address from Senator Ekpe, a live demo of the directory, an inspiring and exciting panel session, followed by a live Q&A, after which we would have a group picture so we could put this in our newsletter, and also finally the closing remarks. Before we get right into it, a few housekeeping notes for all of us. Please ensure that your microphones remain muted throughout the presentation to minimize background noise. Also, we encourage your participation. Use the chat box to ask your questions. Use the chat box to also just interact, engage with other people. You can tag us on social media at Nigeria Mental Health. Would appreciate if you could post the events happening now and also after we're done. Don't forget to tag us at Nigeria Mental Health on Facebook, on Twitter, on Instagram, and on LinkedIn at Nigeria Mental Health. This session is being recorded and a recap of it will be shared afterwards. Thank you for your cooperation. Now, to kick things off, it is my honor to present to you and introduce the driving force behind Nigeria Mental Health, the visionary founder whose passion has brought us to this monumental day. Please welcome Mr. Chime Asonye, who will deliver our opening remarks. Chime Asonye is a public policy advisor and mental health advocate. Currently, he serves as the founder of Nigeria Mental Health. His thought leadership on psychosocial issues is featured in Harvard Africa Public Policy Review, CNBC Africa, and the World Economic Forum, amongst others. Previously, he advanced the United Nations Global Goals, first federally, serving as an associate for the Office of the Senior Special Assistant to the President of Nigeria on the UN Millennium Development Goals. Secondly, at the sub-national level, as the Senior Special Assistant to the Governor of Abia State, Nigeria, on UN Sustainable Development Goals. He received his Juris Doctor from Northwestern University, Pritzker School of Law. Please join me in welcoming Chime Asonye.
How is everyone doing today? First of all, can you hear me? If you can hear me, maybe you can send some smiley faces or things, perhaps, so I know that folks can hear me, or a thumbs up or something like that. Can people hear me? Okay, I see some thumbs up. Great, great. Well, I'm excited to be here today. It's always strange to hear my bio, but this is an amazing event. You guys may not know that we are launching Nigeria's first mental health directory, and it's a little bit shocking that there is a resource like that doesn't exist right now, where in one place you can't see all the information focused on rehabilitation and in-person mental health services. So it's something that was in critical demand. Before I start and I go into all my comments, I'd like to expand on an existing protocol and really thank the different representatives from government, from civil society, from entertainment and media that are here. I'd like to thank the Honorable Senator from Cross River States for attending here today. He's been a partner in progress focused on suicide prevention and advocacy and mental health. I'd like to thank Titi Tade from Serpin, one of the first organizations I got introduced to when I was working in the mental health space that has one of the first crisis hotlines focused on mental health. I'd like to thank Dr. Ojo from the Federal Ministry of Health, the national coordinator. People don't know that there's a lot of reforms going on in Nigeria, but in Nigeria, this is probably one of the least talked about revolution when it comes to public health. All the different changes that the Ministry of Health is shepherding. And then I'd also like to thank Banky W. We've known each other for years, and he's been always been a partner of progress, combining entertainment, combining media in order to make change from across the Atlantic. And so I'm excited that he's here today to talk about the importance of mental health and why individuals should be really involved and galvanized in this movement. So I appreciate all their attendance here today. There's challenges that exist when it comes to mental health. One is silence of individuals trying to get information when they're critically have challenges. A second is data inconsistency. When you're trying to figure out information and in-person resources, you can't find that in a lot of challenges. The third is contact gaps. What if you want to call and figure out information? Is there gender sensitive information? Is there information focused on if you have a mental health challenge with your partner and you want to do couples therapy? You can't find that. There's a lack of emails, working phone numbers, etc. And then ultimately stigma. There's a hesitation from centers to publicly share information on because of things like the law being criminalized when it comes to attempted suicide, and they're just people's conception of what is it that's really the challenge. So it's more of a and that shouldn't be the case. And so what we had in Nigerian mental health for years is we had access to crisis and suicide prevention hotlines. So we curated those hotlines across the country from NGOs, from government, and we had that as a resource. If people would come reach out to us, we always had those resources people can call and contact to get crisis, but we never had in-person care. And what happened earlier this year is there was an actress, I don't want to mention their name now, but there's an actress, and she was outside late at night. And there was a lady that she knew that was in crisis. This lady had been beat. This lady wanted to attempt suicide. And this lady was abused. And this actress sent out SOS on social media, Instagram Live, asking for support, asking where are resources and support for this lady who wanted to attempt to commit suicide. She actually had walked up a building and she was crying and she needed the support and assistance. During that period, earlier this year, Nigerian mental health was tagged a couple of times asking for resources and asking for the support, which is a good thing in one sense because since our founding in 2019, people understand us as a resource and a vehicle to support and empower individuals with psychosocial conditions or challenges. And at the time, the actress specifically asked for inpatient services where this person could be checked in, they could be rehabilitated, they could be supported. And we didn't have a verified list. So we could only point her to the crisis hotlines, even though we knew some mental health centers in Lagos where this situation occurred. We understood at that point that we needed to make a change and we needed to make a difference. And that change and that difference came by putting together a resource. So no matter where a person is around the country, they would have access to verified contacts to mental health support and rehabilitation services so they can support whatever it is, whether it's substance abuse, depression, anxiety, bipolar. We wanted them to have the resources in their hand. And we get together as a group and organization to put this. We need to have a database to respond to this particular cry to help. But this lady's story is just an allegory and a metaphor for a lot of people's stories out there in the mental health space. There's a lot of cries for help, a lot of people that need support. And we are trying to aggregate as much support through our membership to make a difference. So I'd like to appreciate everyone for being here. The power of social media to connect individuals to resources, and someone talking and saying that it's okay not to be okay. Where can I get help? Nigerian Mental Health and our partner organizations and the members of our organization want to always be there as a resource to support individuals in their time of need. And there's so much need in a country over 200 million people. So I'm excited to welcome you here today. I'm excited for you to get involved in what we have going on in this movement and to hear from these important partners about the resources, their opinions about the mental health landscape in the country. Thank you so much for your participation here today. And I look forward to the conversation that we're about to have. And I'll turn it back over to our distinguished moderator, Deborah.
Thank you so much, Chime, for those powerful opening remarks that set the stage perfectly. Now we have the privilege of hearing from a distinguished voice in public health and advocacy. It is my pleasure to introduce to us distinguished Senator Asuko Ekpenyong, who will deliver our keynote address on the topic, Why Visibility Saves Lives. Senator Ekpenyong is the youngest serving senator in Nigeria's 10th National Assembly and chair of the Senate Committee on NDDC. With a background in economics and finance, he has held multiple leadership roles in including Commissioner for Finance in Cross River State and director roles across several institutions. He's also a Harvard-trained public servant and a passionate advocate for mental health reform. Most recently, he introduced a suicide prevention bill to complement national mental health efforts. Please join me in welcoming Senator Ekpenyong. Senator, please feel free to turn on your camera and let's hear from you.
Thank you very much, Deborah. Can you read me loud and clear, please? Can you hear me?
Yes, we can.
Thank you, Deborah. Good evening, distinguished ladies and gentlemen. On behalf of the President of the Senate, His Excellency Senator Godswill Obodo-Akpabio, and the entire National Assembly, I bring warm greetings and commend you for your presence at this all-important moment, the official launch of Nigeria's first National Mental Health and Rehabilitation Directory. This event is not just about a new tool or platform. It represents a long overdue shift in how we acknowledge, understand, and respond to one of the most pressing public health issues of our time, mental health. Across this country, individuals are struggling silently with anxiety, depression, trauma, and other psychological challenges. Too often, they suffer in isolation, not because care does not exist, but because they do not know where to find it. This silence is costly. Visibility, as we know, can save lives. That's why this directory matters. It is a centralized, accessible resource for locating in-person mental health and rehabilitation services across the country. It is a practical response to an urgent need. It is a gateway to hope. The launch of this directory builds on the progress made with the passage of Nigeria's Mental Health Act, signed into law in 2022, which laid the legislative foundation for rights-based, people-centered mental health system. But laws alone are not enough. Tools like this directory helps to bring those commitments to life, ensuring the public and the policy becomes accessible. At the National Assembly, we remain committed to advancing this momentum. The Senate recently passed the Suicide Prevention Bill through its first reading. This bill was sponsored by myself as well as other co-sponsors, and when fully passed into law, will decriminalize attempted suicide and instead prioritize care and protection. It is a signal of our resolve to treat mental health with the dignity and seriousness it deserves. Yet, more is required. We must invest in structures to make this work sustainably. I strongly support the creation of a dedicated department of mental health within the media platforms and community spaces so that everyone in this region knows that support is available. Let me also commend Nigerian mental health for their work on this groundbreaking resource. It reflects the very spirit of the renewed hope agenda of His Excellency President Bola Ahmed Tinubu, especially its focus on the well-being and human capital development of its citizens. A nation cannot rise when its people are mentally and emotionally unwell. In closing, let us remember this. Mental health affects us all, whether as policymakers, caregivers, employers, or family members. We each have a role to play. Let this launch be more than a celebration. Let it be a commitment. Thank you, and may God continue to bless the Federal Republic of Nigeria. Thank you very much.
Thank you, Senator Ekpenyong, for that incredibly insightful address. Your words truly underscore the urgency of today's launch. Now, to walk us through the journey from identifying the problem to presenting our groundbreaking solution, and to give us a live look at the directory itself, I'd like to introduce Mr. Adedeji Adegoroye, the Director of Communications for Nigeria Mental Health. Ade will guide us through the behind-the-scenes report, unveiling the directory, and then provide us a live demonstration. Ade, the floor is yours.
Thank you. It's a pleasure being here. And I would like to welcome us once more. Thank you, Senator, for those powerful words and for being a part of this whole process. I do believe you can hear me clearly.
Very well.
Beautiful. So without further ado, permit me to take us on a journey and share my screen with us. Okay, so we are welcome to Nigeria Mental Health Rehabilitation Directory launch. And to be launching this particular directory is actually a very great privilege. We will like to first and foremost welcome you to our website, and I will encourage us as we're listening to kindly search for Nigeria Mental Health. You can search on your phone, you can search on your laptop, but if you go to www.nigeriamentalhealth.org, you'll be able to access this. Now, when you click on nigeriamentalhealth.org, okay, let's do that here. Nigerian Mental Health. When you click on it, you actually see it's the first page on Google, and it has the green icon, green and white icon. When you click on it, you'll be directed to our homepage, which has a lot of resources and a lot of information on Nigerian mental health. If you're using a phone, you will need to click on the 3 icon bar where you can access the menu or the headers that show you the different aspects of the website. And when you click on that, you'll be able to see our mental health support, which includes the helplines and now launching mental health directory. It's important to note that this is part of the step that we're taking towards bolstering the mental health response systems in Nigeria. And it's a very important step. When you click on mental health directory, it takes you to the homepage, which shows you our actual centers directory. Now, the beautiful story behind the creation of this directory stems from the hardworking team of volunteers, interns, and other members of the team who put in sleepless nights and putting resources and efforts to making sure that it comes to life. The mental health Rehabilitation Centers Directory was championed by Shekinah, who was an intern at Nigerian Mental Health, who spearheaded most of the activities that it took to actually have this before us today. So kudos to Hand team as well. When you read through the directory, you will realize that we have actually been able to make it available, having the names of the organizations, the states, what they do, the services they offer, what time they um, open or they are open to the public, descriptions, etc. Now, this information was not easy to come by because part of the challenges that we had while we were working to have this put in place is that if you check online and you're in a particular state and you're looking for a mental health facility or center, you realize that we have some of them are not online. We have centers that have redundant information that is no longer useful. We also have centers that are misrepresented online. So we decided to dive deeper because when we have an emergency, who are you going to call? How do you resolve this as soon and as quickly as possible? Now, to do this, we had to reach out to each individual organization. We had a lot of organizations we reached out to, and these are the ones that we were able to reach out to and get at least something tangible to put down and say, okay, this is where they are. This is their website. These are their phone numbers and emails, etc., etc. Now, it's also important to note that a few things. A few people didn't pick their phones. A few people had wrong information, outdated information, which posed a very, very serious challenge. And this is also one of the reasons why we need to actually have this active. I'll be quickly taking us through the interface, and I think we should be able to navigate it going forward. So when you come to the interface, we actually have on this column, we have a list of clinics. We have other centers as well, rehab centers, hospitals that offer mental health services. And this is important because as a person who is going through a mental health condition, or if you have a certain challenge, you don't have enough time to do so much research. So this research is very important. We do have it grouped by states. We have it grouped by what services they offer, and it's very easy to navigate. When you click on names, you can actually sort from A to Z. So you can have the centers sorted from A to Z according to the names. And if you want, you can also click on states and have it sorted from first to the last. And that way, you can have it sorted in a way that the names are similar. So if you're looking for perhaps a center in Kano, a center in Kano will be will be grouped together. And then if you're also looking for what category, you can also group the categories and know that, okay, I'm looking for a mental health center or I'm looking for a hospital. Teaching hospitals are grouped together. And if you're also looking for opening hours, description of what they do, you can always group these things together. And another important thing to mention is the comments. We can also now give feedback. Perhaps you have actually visited some of these institutions and you are actually needing to give some feedback. It was good. The service was awesome. I would recommend it. Or I went there and this is what happened. That's the importance of the feedback. But we cannot do this alone. As mentioned, this is the first step, and we are looking to have a more robust mental health rehabilitation centers directory. These are first step, and that's how you can become a part of it. You can become a part of joining to making this a success. And in order to make this a success, we have also given the opportunity for you to share your knowledge. When we're going through the whole process of finding centers, as I mentioned, some of them were off-grid. We actually probably have centers around you in whatever state you are in Nigeria that are not here, and probably they are not online. So we may have people who have visited or know about the centers. We need to share them. If you look at the records, we have about 49 records here, meaning that we have about maximum of two per state, meaning that we are understaffed and under-resourced, obviously. So sharing some more information is key. And this is how you can come in. So if you look at the page, we have a place where we said this short update form. It's a clickable link. It says, please fill out this form if you have, if you want to add a center, or maybe you went to a center and you need to update the existing information, maybe share a phone number or share general feedback, you can always click on this link, which I'll do right now. And it takes you to a form. So right now we're actually accepting responses where you can actually share your email, and it records your email so that we also make sure that we do not have robots submitting information. But then if you're the contact person or the name of the person that's submitting the form, you input that, you put the email address, and this is necessary for follow-up as well. There are other informations that you need to share with us, perhaps the name of the center, whatever it is you want to update, maybe the new address, services they offer. Do they have a website, a new website? Perhaps you're working in one of these institutions and you need to also share the website. I think it's very important for us to be visible as well. I know among the panel, among the those of us who are attending this event, we also have people who head organizations, people who are working with organizations that are dealing with mental health conditions. So this is something that if you are not already registered on Google, or if you're not already on this particular form, if you're not part of the direction that we are collating, you can also share your information so that when people reach out to us, they can always have someone to reach out to. Already, we also have what we call the mental health helplines, which we are partnered with different organizations globally, especially in Nigeria, to provide services. So this is another way by which we can help curb the challenges that are faced by insufficient data or insufficient support for mental health. And with that, I really appreciate you and your time. I will now be handing back over to our wonderful program associate, Ms. Deborah. Thank you for having me, and I wish you all a wonderful rest of the event. Cheers.
Thank you, Ade, for that excellent and comprehensive presentation showing us how exactly the directory works. Now we'll move to the highly anticipated segment of this event, our panel discussion titled Building Bridges, Collaboration and the Future of Mental Health Access. This session is designed to look into how we can collectively strengthen the mental health systems and accessibility in Nigeria through partnerships and envisioning a truly inclusive future of care. For our esteemed panelists, please you can turn on your cameras now. I will be introducing our panelists, starting with Banky W. I am delighted to introduce him. He is a renowned artist, entrepreneur, and public policy advocate with nearly 2 decades of experience in shaping entertainment, philanthropy, and governance. He co-founded Empire Mates Entertainment and has led high-impact advocacy campaigns with UNICEF, USAID, and the European Union. He recently earned a master's in public policy from Georgetown University, where he served as president of the African Policy Students Association. Banky uses his platform of over 9 million followers to drive change across mental health, education, and civic engagement. Welcome, Mr. Banky W. Now I would introduce Titilayo Tade to us. Titilayo Tade is the head of medical social services at LUTH and the training coordinator of Shopping. Shopping stands for Suicide Research and Prevention Initiative. With over 25 years of experience in mental health, HIV and AIDS, and social work, she helped launch Nigeria's first suicide prevention hotlines. Ms. Tade is also a board member of several nonprofits, a lecturer at Unilag, and a trainer who has worked across Africa, Europe, and North America. She is a fellow of prestigious Lead Fellowship. And now to our representative from government, Dr. Tunde Ojo. Dr. Tunde Ojo is the National Coordinator for Nigeria's National Mental Health Program under the Federal Ministry of Health and Social Welfare. He is a consultant psychiatrist and a global mental health expert. He holds advanced degrees from King's College London and the London School of Tropical Medicine. With deep experience in mental health system design, Dr. Ojo leads policy implementation and service scale up nationwide. His work focuses on integrating mental health into primary care and driving evidence-based reform across Nigeria. Again, you're all welcome. Kindly turn on your camera and let's get started on this panel session. Okay, so starting with round one, I'm going to start with Dr. Tunde Ojo. The National Mental Health Directory put together by NMH makes mental health services more visible today, but lasting impact requires structure. Building on the Mental Health Act, what steps can the Ministry of Health take now, like launching a national mental health roadmap or establishing a dedicated department to institutionalize visibility and coordination nationwide?
Okay. Once again, good evening, everyone, and special thank you to Senator Ekpeyon for making it to this meeting and for the great thing that you are doing at the National Assembly. Let me join my voice with that of others to congratulate the Nigerian mental health for this very noble initiative for coming in to close this very good gap, I mean, big gap, I would say. So it's quite commendable, and I think it's quite fantastic. And I know from the presentation, quite a lot of things have come up. Would like to work with you more. That there are quite a lot of gaps on this, and there are a lot of data that we can make available in some department in the ministry that can further expand the numbers that we have presently. Having said that, so the gap and then beyond this, I believe that, like you have said right from the beginning, we are making some progress. I believe the game changer would be the creation of the Department of Mental Health, among other things. But as you can allude to from different fora before now, that change does not come at a sweep. The department will come among many other things, but I believe that let's take it one step at a time. We know that the what's it called? The roadmap for the implementation is awaiting the final endorsement, and I don't want to give days to it, but I can tell you that there is a political will more than ever before on the side of the present administration to address the mental health of Nigerians. And you will see that coming not so very far from now. Thank you.
All right, thank you, Dr. Ojo, for shedding light on that. At least this gives us a clear path moving forward, knowing what we should expect from this space. Now, moving to Titi Tade, you support individuals during some of their most vulnerable moments. From your frontline perspective, how does the lack of verified or accessible service information affect outcomes? And how do you see the directory put together by NMH filling this gap?
So thank you. Good evening, everyone. I hope you can hear me clearly. All right.
Yeah.
Sorry, can you hear me?
Yes. Yes, we can.
Okay. All right. Thank you. Thank you. I wanted to get that feedback. Okay. So good evening, everyone. Thank you so much. Thank you very much, Senator Ekpeyon, for your keynote address. Thank you very much, Dr. Ujo, as well for your comments. And this is very important. Thank you, thank you, W, for being here and everyone that's here. This is Nigerian mental health putting this together. like you said, is a very laudable thing. And it's something that has been a long time in coming. And it's very heartwarming to see so many people here who are passionate about this. The reason you're here is because you're passionate about this. And so, speaking from Serpent experience, when we started the hotline, we started it. So, like she introduced, I work at Luth. And when we started, it started in Luth, and then it gradually expanded outside the hospital because we were getting calls from outside the state. And we needed to be able to refer people to some of these to facilities outside the state. We work within a teaching hospital. So it was easy for us to reach out to professional centers and find out, tap into their. We are located, or we have people in all the 36 states, including the FCT. But those are people that work within the profession, but they're not NGOs. And it is important to be able to collaborate with NGOs. And I'll tell you why. Something works basically with suicide prevention. The other mental health professionals work in the space of mental health. But there are some other issues that come with mental health, the social issues, like some cases, people who have past traumas from rape. We have a lot of people in IDP camps who are going through a lot of things. So you have a lot of social issues going on. 2020 in Nigeria, October 2020 in Nigeria, a lot of trauma came off that. So you have a lot of people who have social problems who need to be referred to other facilities. We can handle mental health, we can handle suicide prevention, but if somebody needs legal aid, where do we send the person to? In Kafancha. If somebody needs legal aid in the middle of Delta, where do we send that person to? We don't have this. So the Nigerian Mental Health Directory at this point in time it's very, very opportune. It's very important. It strengthens the work we do, not just for us as something, all the NGOs, because we do a lot of work in silos. And we're not working enough together. It's important that we reach across, our different fields and join hands to strengthen the services we are providing. That's the only way we can ensure that our services are worth the effort that we are putting in to provide this service. So I would like to commend NMHA, NMA. You mentioned the importance of, I saw it in the chat, the importance of updating it. We need to consistently update it. We need to consistently update it, provide information to you guys when numbers change, and the onus should not just be on you, but it should also be on the NGOs to do that respectively. So thank you so much.
Thank you, Mr. Day. Indeed, you have highlighted the importance and why it's necessary for people to have access to the help that they need. And very much importantly, highlighting the points that mental health does not exist in a silo. Rather, it is a cross-cutting thing, and all institutions should work together. Now, moving to Banky W, you've used your voice to push mental health awareness. What does access or inaccessibility look like for the average Nigerian based on what you've seen or what you've heard? And what role does public trust play in that journey?
Okay, thank you so much for the question and for having me here. I will stand on existing protocols like all Nigerians do at these kinds of events when you have so many amazing people. So thank you everyone for all the work that you're doing in these different silos for this very important issue. So in terms of what I've seen, access to mental health resources in Nigeria is both limited and layered with stigma. So for the average Nigerian, especially those that are outside the major city centers, mental health care is either completely inaccessible or it's prohibitively expensive. There's a glaring gap between the need that exists and the available services. So you might have a handful of clinics in urban centers, metropolises, Lagos, Abuja, places like that. But for rural communities, for example, it's almost non-existent. And the problem isn't just about availability, it's about trust and understanding. Many people are afraid to speak up because they either fear being judged, misunderstood, or dismissed. I think mental health, especially in a place like Nigeria and really across Africa, it's not something that we've discussed as a society for far too long. We've not really tackled it. We've not really embraced conversations about it. Uh, a lot of times, if you try to bring it up in traditional Nigerian or African homes, they'll tell you, "Oh, go and pray," or go and say, "Pastor." And listen, I'm a man of faith. I believe in the power of prayer, but I also believe there's wisdom in seeking help. That's why these resources are there. And that's why, for me, it's important to use my voice and my platform to push for these kinds of conversations, because the first step to closing the gap is breaking the silence. Public trust plays a huge role. If people cannot trust the healthcare system to treat them with dignity and confidentiality, then they won't come forward. And this is really not just a mental health conversation, but Dr. Tade was saying something very important, how there are many linked issues around mental health, right? So it's somebody may be struggling with a mental health challenge, whether it's anxiety or depression or suicidal thoughts, but it may be linked to some other kind of trauma like rape. And many states in Nigeria are not doing the best job in terms of providing the confidentiality and the support services needed for people who have been victims of these kinds of crimes. So we need a system where people feel safe, where they feel heard, where they are supported. And I think the starting place is normalizing mental health conversations. So for me and my wife, for instance, this is so important to us that we are actually, one of the next set of films that we're going to do actually tackles mental health in a very creative, kind of entertaining, heart-wrenching type of way, in the way that films can be, but still driving home this importance of mental health and suicide prevention and things of that nature. So I think, again, I want to stop by applauding everybody here and all the amazing things that you're doing. And I'm happy to be here to be a part of this conversation. And we need more about it, so that people can feel heard, they can feel safe, and they can be supported.
Thank you so much, Banky W, for that take. We're also very much excited hearing about your film that will come soon from you and your wife. We look forward to it. Thank you so much. Now, let's move to the second round of questions for our panelists, starting with Titi Tade this time around. Beyond testimonials, how can non-governmental organizations, government or health systems genuinely center the voices and expertise of people with lived experience when designing care systems or tools like the directory we've put together?
Okay. Thank you very much for that question. I am going to assume that what I'm saying is something that NMH did in the process of developing the directory. And one of the things we have, which is custom all over the world, it's not only Nigeria, is this issue of tokenism. We want to develop the directory, we want to develop a tool, mental health tool, something. We'll get one person, maybe a popular person with lived experience, sort of, and we push that person who's going to be the face of it, and we push it across. We push the person around, and that's the person. But when it comes to the nitty-gritty, the person isn't as involved in the developing the tools. The person is just helping us with the advocacy. If you want to center the voices of people with lived experience, we need them actively participating in co-creating these tools, and not just consultation, not just advocacy. We need them actively being part of the people helping to develop the tools. And the importance of this is because they are the service users. They are the ones that see the gaps we don't see. We are creating this beautiful thing that we think is wonderful, but they're making use of it. So they're the ones that will tell you, well, when I got to this facility, like somebody said earlier, well, I didn't meet anybody. They said I should have come at 9 a.m. But when I got there at 9 a.m., there wasn't anybody there till 11 a.m. And that's why I love the aspect of the fact that you have feedback in the directory so that people can actually make comments about it. It's very key. They see things like language barrier that we will not notice. How will somebody, if they get there, how will the person communicate? With SERPing, we have a hotline. One of our hotlines is in Hausa, and it's being run by Youth. Shout out to the mental health staff at Youth. They run that hotline, and it's in Hausa. We're trying to expand into Yoruba, into Igbo, and some other languages, but it's been a huge problem. Those are resource issues that we can't go into today. But language barrier is a huge problem. How do we ensure that people accessing these tools, when they get to the facility, will be helped in the language in which they understand? Because mental health, describing it is very personal, is very cultural. There's some descriptions that people can only get across in the language in which they are, how do they say, it's their mother tongue. That's language in which how they best know how to describe some of these things. So language barriers, you want to look at things like referral fatigue. For those that work in a clinical setting, information is key, meaning that every time the patient gets to you, we need to hear your story. But that patient has told that story 10 times before getting to us, and they're tired. You understand? So we need to look for how to create tools in such a way that we put them into consideration. They help us develop the tools to make it better for their use because they're the ones using it. So we don't need to do the tokenism, just using them for advocacy. Like I said, we need to look at using them to help us co-create and also providing paid roles. If the organizations, we talk about inclusion, we talk, but how many organizations have people living with a lived experience, working with them, helping them in paid roles, and not just, oh, you're our ambassador or you're our advocate, and we pull you up whenever we're having an activity. So those are the ways in which I think that's a major way in which we can ensure that their voices are centered. Thank you very much.
Thank you so much. Indeed, all you've said is so on point, and it emphasizes the phrase, nothing about us without us. Now, moving forward, let's hear from Dr. Tunde Ojo again. Mental health intersects with housing, justice, education, and more. From your view, what cross-sector collaboration models do we need, and how can we improve data systems or regulation drive moving forward? Dr. Tunde, you're muted. Okay.
Yeah, seems you put like 4 questions in one for me. So intersectoral collaboration, data, and then what's that last one? Well, so I think the social worker is there, and Banky W has also made us to know the very critical role that the creative and entertainment industry will have to play in our mental well-being. And I can't say that I can't wait for that. You know that one of the big thing or the worst thing that has happened to mental health in Nigeria is the Nollywood narrative of mental health. Very, very wrong narrative. And you can imagine if Nollywood begin to shape, normalize the conversation, how that will go a long way in solving a lot of problems. We're talking the major issue is stigma and discrimination. And if you are able to work on that, even research have shown it's not just about availability of service or not, but stigma, even when those services are available, stigma is a greater barrier than even finance. And so I'm not trying to deviate from the question. Entertainment has a big role to play. We talk about the social determinant of health and the intersectionality, the multi-sectoral approach. And that's why we are very deliberate about what we do at the Federal Ministry of Health. There is a Department of Hospital Services that is in charge of treatment, but the National Mental Health Program takes a public health approach, a society-wide approach to addressing mental health. And of course, I don't want to say government will take responsibility for this, but at the level of policy making, our engagement with stakeholders has been cross-sectoral. We bring the Ministry of Social Welfare, the Ministry of Poverty Alleviation. All of these have a role to play. Even if you are talking about education, if you talk about lifespan approach to this, we know that 50% of mental health conditions are established by the age of 14, 75% of them by the age of 24. Look at that window period of 14 and 24. If you go to all of our institutions, how many, these are the productive stage of people. How many of our university system have mental health support system? How many of our teachers are even, does our school program curriculum have basic things about life skills, building resilience, social connectedness? These are the things that will transform mental health conversations. When we begin to look at mental health from an across lifespan perspective, from public health perspective, rather from the very disease perspective. When we see it this way, everybody will see the role that they have to play. I know that in Nigeria, we are still far away from it, where we will be talking about social housing. In the UK, in other climes, these are people that are given priority to. But this is even when people already come down with the conditions. But apart from that, if you are talking about urban, if you are talking about climate change, globalization, how urbanicity is affecting our mental well-being, the technology ministry that is responsible for technology will be looking at impacts of how does technology affect our mental well-being, both positively and negatively. Is if when we have this cross multi-sectoral approach to this conversation, that we can have it in a very exhaustive and a productive way. I'm not sure whether I've successfully answered the question, but I'm sure that I've been able to at least shed more light to the approach that we should address mental health issues. Thank you.
Thank you so much, Dr. Ojo. Again, what all you've said has shown the importance of stating, of us knowing rather, that mental health does not exist in a silo. Rather, collaboration across sectors is key for all of the population, with respect to especially the youth population, as you have mentioned. So before we go to our next panelist, Banky W, just to put it out there, if you have questions for our panelists, kindly type them in the chat box. After we are done with asking the panelists questions directly, we'll look at the chat box, take some few questions, and direct it at them. So now to Mr. Banky W. If you could shift one thing in the next year, whether it's public mindset, media framing, or public priority to strengthen mental health access in Nigeria, what would it be and why?
So I think if I could shift one thing, it would absolutely be the public mindset. I think we've made some progress with awareness about mental health challenges, but stigma is still probably the biggest challenge. People are still hesitant to seek help or even talk about mental health because they're afraid of being judged or misunderstood. I think if we can normalize mental health conversations, if we can make it as easy to see a therapist or even talk about seeing a therapist as it is as easy to talk about seeing a doctor for a fever, then we'll create a ripple effect that affects everything else. I think, there's clearly no stigma in just going to see a doctor for any organ in your body. So why is it that when it comes to your brain and your mind and your soul and your mind, your will, your emotions, your heart, which actually dictates everything else, that's where we put the stigma on. And I think we've made a mistake as a society for far too long. So once that mindset shifts, then policy priorities, media framing, all of those other things that are necessary will move faster. I think we'll have a stronger base of advocates pushing for better funding and training and facilities. The media will begin to tell more stories that reflect the reality and the resilience of those facing mental health challenges. Because let's face it, they are not when you talk about mental health, we're not just talking about victims, we're also talking about victors, people who've conquered, incredible odds to make it on the other side of this. So sharing those stories will become more commonplace. And for me, it starts with us, right? So I think I've always been a proponent of, when you point a finger at the system, the other fingers are pointing back at you. So what can you do? And, in that regard, I tip my hat to everybody on this call who, clearly everybody's doing incredible things in trying to move the case for mental health forward. And that's why, what we're trying to do as a couple that's still in the filmmaking business. My wife wrote a brilliant, brilliant film. It's an amazing script that she wrote herself, and she's going to direct it. And I'm producing it. And, layered in this film is this subtext of mental health. And I think it's gonna be a film that potentially could change the world. So I'm excited about that in terms of our own contribution to this cause. And I just encourage everybody, here to continue to do what you can, and then to find other people who are doing things to partner. Because I think the more of us that can collaborate, and we, like Dr. Tade said, stop operating in silos and find ways to collaborate with each other, the more that we can do that, then we can change hearts, we can change minds, we can create a new culture where mental health is seen, heard, and supported. And that's really what we're trying to get to at the end of the day. So with that being said, I would like to close by giving a massive shout out to Chime, my friend of many years, who's doing amazing things, and the entire Nigerian mental health organization team. Thank you for convening this and for having me just, share a couple of words with all these esteemed speakers and workers in the mental health space. It's really been a pleasure and a privilege. God bless you guys.
Thank you so much, Mr. Banky W. And now we'll be moving to the question and answer section for the panelists. Please write your questions in the chat box. We're going to take between 2 or 3 of them and we'll share with the panelists. So please, let's go. Also, if you would like to speak, you could raise your hand and would unmute you, and then you can go ahead. Thank you.
Deborah, I think there's a question in the chat from John Bosco.
All right, thank you. So the first question is, to what extent is the film industry working with academics and researchers? I want to believe that this may be directed at Banky W.
Yeah. So I don't like to speak on it, like in general terms. So when you ask me to what extent is the film industry working with academics and researchers, I don't think that I'm in a position to speak for the entire film industry, right? And I think most people who are in the filmmaking business work with some level of research, depending on what the topic of the film that they're doing is. So, for instance, with our film, I've already discussed this film with Chime. Chime is very aware of it, and we're finding ways to collaborate on the back end of that. So I can speak for us in saying that we are doing that. But in terms of the film industry as a whole, I think you run into trouble when you try to generalize and say, is the entire film industry doing this? And, the reality is not everybody will work on every issue, right? So I think you have to give space and grace for people to pursue what they are passionate about. So for some other filmmakers, it might not be mental health, it might be poverty, it may be just entertainment. People need to be entertained. It may be it may be corruption in government, it may be police brutality, it could be any issue, I think. So I think the question, I would respectfully disagree with the premise of the question, saying that what is the entire film industry doing with researchers and academics. I think you'd have to ask each filmmaker, and it depends on what topic that they're working on. So I hope I've answered that well.
Thank you so much. We'll go to the next question from Mary Lawal. I can see your hand is up. Please, I've asked you to unmute yourself. Kindly do so and ask your question.
Hello, hi. Yeah, my question is for Banky W. So I know you spoke about faith and mental health, like the stigma surrounding mental health, and a lot of people talk about how when they open up, their response is like to pray about it. So, how would you address someone like, for example, someone opens up to you and their instant response when they're struggling is to just kind of pray about it or talk to God? Like, how can we intersect more of faith and mental health together?
I think that for me, it's not an either. Well, I guess my response would be that it's not an either or situation. So I think you can pray and go see a doctor, right? You can pray about. Let's talk about regular illness. You can pray about what is bothering you and still take medicine. I don't think that that is being anti-faith or anti-scriptural. In fact, the book of Luke was written by Luke, who was a medical doctor. The book of Acts was written by Luke, and he was a medical doctor. And if you really read your Bible, you will know that he was also attending to people who were sick. So there was a place for spiritual acts of God to heal people, but there's also a place where God has democratized healing amongst people so that it's more easily accessible, right? So if a doctor and medicine is encouraged in the physical sense, then there's no reason why a therapist shouldn't be encouraged in a mental sense. Because again, like I said before, the brain, your mind, your will, your emotions, your soul, all of that is as much is as critical, if not more critical, to who you become than like your physical organs. And so I think the encouragement would be to do both. It's not one or the other, it's both. In fact, one of the things that I am encouraged by, um, I was speaking with a pastor that is here in the US. I happened to be here because I came to get my master's in Washington, D.C. And the church that I go to here is Union Church. The pastor is Pastor Stephen Chandler. It's actually the fastest growing church in America right now. And the pastor talks openly about the fact that he has a therapist. And he has a therapist that he sees regularly because he wants to stay on top of things. Now, this is a pastor, okay, the senior pastor of the fastest growing church in America. And if he can talk openly about going to see a therapist, then I see no reason under the sun why any congregation member anywhere around the world would then stigmatize this idea of going to see a therapist, working on your mental health and things like that. So I think those are the things that I would draw on to encourage people. I mean, looking in Lagos, my pastor in Lagos is Pastor Tony Rapu, and he's somebody who has. I mean, if you know anything about him and the work that he does, it's not just like a spiritual thing. He actually does rehabilitation of people. He's very involved in whether it's mental health, drug addiction, prostitution, people who have struggled at different layers of society. And that's one of the things that attracted me to him as a pastor and to his ministry was his efforts to kind of be a part of the change that we seek in Nigeria. It's not just about getting people to come to church. And if the Bible says we are the light of the world, that means we're supposed to be in the world shining light and helping the world come out of darkness. And I think that that's one of the things that as children of God we are called to do. So I think that I don't know if that answers your question, but for me, it's a no-brainer. And these are the things that I would draw on to respond to whoever um, has those kinds of who has that conflict in their mind about whether if I'm a person of faith, can I go see a therapist as well? I think Dr. Tade has her hand up there. Is it that you want to say something, sis? Please, I think you should go ahead.
Yes, thank you so much for that. I just wanted to add that one of the things that we do at SOPIN is the fact that we work with religious organizations. And when I say religious organizations, we've done trainings in Lagos, we've done trainings in Ife with uh, with Christian clerics, Islamic clerics, and everything. And we've taught them about the most common symptoms you find in mental health when you're talking about things like depression, anxiety, substance use, because those are the most common illnesses, mental health conditions that we see in the community. And the truth is, people will usually turn first to their religious leader because they're maybe hearing voices, they can't sleep. And we are a very spiritual country. So usually they turn to spiritual leaders. So adding to that, it's also important that we carry spiritual religious leaders along in this journey. Dr. Ojo was talking about multi-sectoral. It's very important that
Okay. Well, maybe not trying to overflow the matter, but I think just to add my voice to that of the contribution. So it's a Tade said Nigeria is a very religious country, and we have pastors, clergymen in the two major religions closer to the people than anyone else. And they believe so much in them. And so whatever they tell them, they listen. And a lot of us will have seen conversation. It's beyond getting them to understand what are the symptoms, but even to get them to know the critical role that they stand to play. There are people that have dropped their medications and have had relapse, not just for mental health conditions, but general medical conditions, because quote and unquote, they've been healed by faith. There are people that, frankly, psychotic, and everything that we are doing in low and middle income country now, UK, US, Spain, they have been there. We attribute mental health condition to demons, household wickedness, and that is the religious connotation to it. But around the world, UK, they were there like 500, 600 years ago. And this is still the major things that affect our coloration. And if people believe that it is witches, wizard, demonic possession, they will not get treatment on time. But if they have the understanding, and I was very, very happy as a national coordinator when I went to some church services, and then I started seeing in their Sunday school discussing suicide, depression. These were not conversations that some pastors will want to have before now. The issue of what's it called? Attempted suicide is seen as a sin. If we want to decriminalize attempted suicide in Nigeria, religious barrier is one of the biggest thing to it. And so, in trying to go that way, we know that from the very beginning, in having national conversations, the role of religious and traditional leaders can never be overemphasized. So I believe across anything that we want to do from policy perspective, from programs, we have to go together with them or it will be a lost battle. Thank you so much.
Wow, wow. One question has surely brought about so many responses from all our panelists. Thank you all for your insights on that question. We'll take one more question and we'll round it off for this session. I'm directing this question to Dr. Ojo. How are youths being involved in all these policies and action plans towards mental health? Let's hear from you. How does this happen? What are they doing for the youth? How do we involve them? Thank you.
Okay, so I will say that it is for the government to make policy and to create enabling environment for its implementation. In the policy formulation cycle, we carry young people along, youth organizations, not just about that, but even the Ministry of Youth Development, among others. So I would say from that perspective, is one way that we are addressing it. But just like I've said, that mental health is everybody's business, all across level of government, across initiative, and there's no one that want to do anything seriously and that will not consider the youth. A country that has more than 60% of its what's it called of its population as youth. There cannot be anything. There cannot be something for us without us. And so you can't develop things and say that this is for you without them being around. And that's why I'm also very happy with some of the initiatives that are going on. presently with the Ministry of Youth. I think about a week or two ago, they have a yo-yo initiative, which is about addressing the health concerns of young people driven by youth, and mental health was one of the cardinal things that they are trying to address through those initiatives. Thank you.
All right, thank you so much, Dr. Ojo. Now we're going to be taking a group picture as we come towards the end of this event. So I encourage all of us kindly turn on your cameras. You're attending the launch breaking event, the groundbreaking event of the launch of Nigeria's first National Mental Health Directory. So please turn on your camera. Let's have a group picture to put together this event on our social media handles and continue to spread the awareness. Please turn on your cameras. Ade, please, over to you. Kindly take the group picture. Let's smile for the camera. Thank you. Ade, can let us know when we can stop smiling. Thank you.
Yes. One more second.
Okay.
3, 2, 1.
Yeah.
And 2. I don't understand. I'm supposed to 1. Noise, beautiful smiles. Thank you.
Awesome. Thank you so much, Ade. Thank you to all our panelists. I really appreciate you doing this with us. Banky W has to take his leave now. Thank you so much, Banky W, for joining us. So now we'll go to the closing
Bye.
remarks from the founder of the organization once more. Please let's hear you, Mr. Chime Asoniye.
Thank you very much. Some ups for our panelists, Banky W and others that were doing so well. Can we get a clap for them? I don't see any stars. I don't see any flashing lights. There we go. I'm seeing the claps now. We have 7 claps. We have hearts. I love it. We have flashing lights. They were amazing. I think they were incredibly, incredibly amazing. And I'm so honored. Honestly, this work isn't paid or anything like that. It's just exciting to do. And when I'm part of these kind of conversations, I'm excited to continue to pursue our passions and make sure that everybody understands the connection between physical health, social health, and mental health, which really make up the right to health. So if we're not talking about mental health, we're not talking about the right to health. I have some things that I think are important from the conversation that I think are clear next steps. So let's start there. Dr. Ojo from Federal Ministry of Health talked about how there's a database that he's aware of in the Federal Ministry of Health that we can use to help expand our database. We look forward to collaborating on that. It's unrecorded, Oga, Federal Dr. Ojo. So we will take that as something that we'll clip and we will send it to the minister and say, this is what the Oga. The second thing from the Federal Ministry of Health's angle was about the Mental Health Act. And we talked about the Department of Mental Health. And I think it's clear to say that there's a question of will, but we're not circumscribed something done. The Federal Ministry of Health, working with other collaborators, passed through the National Assembly the Mental Health Act, and many of us on this call were working on that in 2022. We're in 2025 now, and one of the cardinal things that are supposed to be created is a Department of Mental Health, and has not been created, which means that everybody on this call needs to be excited about pushing the call to create a Department of Mental Health. It's one of 3 institutions that are supposed to be created in the Mental Health Act. And if we don't have a department, that means we can't get a lot of this critical administrative, logistic, and strategic planning around mental health in Nigeria. The second key thing focused on the Mental Health Act that I think is a critical next step is around religion and faith that Dr. Ojo mentioned. One of the institutions, including the Department of Mental Health, is a mental health fund and also a mental health human rights committee. And unlike other countries, in Africa, Nigeria did a great job of institutionalizing and mainstreaming things around traditional and faith leaders. We're supposed to have a traditional faith leader on the Mental Human Rights Committee, which means that bridging that nexus between rights, health, and faith doesn't happen if we don't also create the other institutions that are important for the Mental Health Act. So I would encourage other individuals that we could work with the ministry to get them to create the Department of Mental Health and also work with the National Assembly to do that. The third thing that Dr. Ojo mentioned was about the roadmap for the implementation of the Mental Health Act. We believe that the federal ministry, because Nigerian Mental Health was one of the actors that was invited to help draft the roadmap, that we'll get that launch and do any final T's and I's this year, the second half this year. Let's get that launch and make sure there's a clear monitoring and evaluation framework so we can look and see what are the progress to make sure that we're achieving the Mental Health Act. And then finally, we talked about helplines and crises as well. I'm excited to say that in the National Mental Health Strategy and the National Suicide Prevention Strategy that Nigerian Mental Health was one of the authors, along with the Federal Ministry of Health, we have called for crisis hotlines. And we're actually in contact with the organization that Dr. Ojo mentioned at the end to discuss their new helpline to see how does it work and can we get it on our list of crisis hotline that's available on Nigerian Mental Health. Titi Tade from Dr. Titi Tade from Luth mentioned some important facets that are very key. One, which is the social dimension when it concerns mental health, things like trauma and rape and legal aid. We have done past partnerships with the National Human Rights Commission, and we continue to want to invite other partners. If you have referral services or other social services that we can connect to those with mental health conditions, please contact us. We would like to get that and maybe even do a database where we can educate other mental health practitioners within our network and within the database of other services that we can link so we can get the cross-cultural collaboration that individuals like Deborah were talking about. And then Banky W did a great job discussing the media and entertainment and framing. He mentioned that he has, him and his wife are working on an upcoming mental health film that's very critical. We look forward to potentially collaborating with him to bring that. And if I would invite others, if you have entertainment or film or things you want to collaborate with Nigerian Mental Health, please just send us an email, and we look forward to partnering and collaborating with you. With that, our final call to individuals, as you can see on the screen here, is to the government agencies. I've just discussed that. To mental health organizations, we would love to collaborate and partner. Please, if we're contacting you concerning some of the people who have written in the chat, be responsive, be visible. We want to be online so individuals can access their resources. So please, if we're contacting, be engaging and help us. To civil society organizations and donors, invest in digital infrastructure, invest in contact information, invest in mental health literacy. These are things that can be financed and funded. If you want to support with an organization like Nigerian Mental Health, you can find us on, you can go to our website, www.nigerianmentalhealth.org. Resources and information about us will be shared in the chat. So you can connect with us, you can donate and support our efforts and support the staff that help create these things and these other resources. If you also have ideas, you can reach out to us because we love to hear them and see if we can bring them into reality. Just like this particular database is a product of an individual cry for help and us trying to respond to that need. And then finally, the public. This is really important. Share this directory. There are individuals that you know that are in need, individuals that need support, individuals that need this information updated to know if it's accurate. The moment of crisis is not when we're supposed to be updating this database. It's the moment before that when individuals need it. When they need it, it's an acute crisis and they need it immediately. So please help us update this information. And you can get involved right now as a volunteer, by reaching out to us, as an intern, by reaching out to this. This was spearheaded initially by an intern before the larger team got integrated. So it's a competitive internship and it's hard work, but we also have staff positions and things like that. So just reach out to us and we can collaborate. And then finally, to follow up on Senator Ekpa from Cross River State, is to support efforts to decriminalize attempted suicide. Currently, Nigeria has passed a mental health strategy that calls for the decriminalization of attempted suicide. There is a mental health prevention bill that was drafted by the Nigerian Suicide Coalition, which Nigerian Mental Health is a partner, and was initially introduced by the National Assembly this year. September is Suicide Awareness Month. What can we do as a public to get and push that suicide prevention bill? We're one of only less than 20 countries that have this imperialist colonialist legislation, and we've done a great job by trying to follow suit and work with the National Assembly and work with the Attorney General's office and work with the Federal Ministry of Health. You can see from Dr. Ojo that this is something that's a passion and something that they important. We look forward to partner, but government can't do it alone. They need the pressure and demands of the citizens in order to push these things. So you can go on our website, www.nigerianmentalhealth.org. You can go to our Suicide Not Crime NG. You can sign our petition. Thousands of people have signed our petition, and you can read our policy brief on this matter. And you can also read the introduced suicide prevention bill as we speak. And then finally, if you can go to the last slide, Deborah. Final slide. And then finally, please connect and contact. We are on everywhere you are. And if we're not where you are, let us know and we will add a profile. Go to the Nigerian Mental Health on all your social media platforms. Follow us on our website, www.nigerianmentalhealth.org. Reach out to us. We're excited to collaborate and partner with you so we can strengthen the support, the structure, and respond to the cries of help for individuals who have mental health conditions or facing mental health crisis in Nigeria. So I want to thank everybody for attending today, and I want to pass it over to Deborah.
All right, thank you so much, Chime, for that closing remarks. That was indeed powerful. And with that, I want to say we have officially concluded the program of the launch event of Nigeria's first national in-person mental health and rehabilitation centers directory. On behalf of the entire team at Nigeria Mental Health, and personally, I would like to say thank you for being a part of this event, moving forward and improving access to care for all Nigerians. Once again, we encourage you to use the directory and to share your feedback, your information that you have, which you'd like for us to use to update the directory. Thank you and have a good night, everyone.